Take 4.
Take 4. Okay, so hi, thank you for joining us for this video that is going to go over how to properly don and doff PPE and our PAPR machine in case we ever need to use the PAPR. So Mandy is going to be instructing me what to do, and then I'll be performing those skills for you so that you can watch and learn, and Anna's going to be helping. Sorry.
Okay, so the first thing we're gonna do is Rachel is gonna make sure her hair is tied back, and then we're going to put on a surgical hat and then a surgical mask as well.
Great.
Okay, our PAPRs are located right outside the operating room. If they are not out here, we need to call CS and have them bring us up a cart or 2. These PAPRs are plugged in and they should be charging when you get there. They hold an 8-hour run time if they are fully charged. So what you'll do is you'll unplug like so. And then this you can have some assistance with, and our lovely Vanna White will come and help.
Thank you kindly. Okay.
So it wraps around your waist, and the clip, it just slides through, and then it pinches the belt. And then there's also a flappy belt buckle loop. Right? Yeah, right there. Good.
There we go.
Okay. And then the hood gets applied and it goes under her chin. So the rest of the hood will be pulled back so that it fits nice and snug on her. And then you can turn it on now at this point, or you can wait. There's a little button right there. Voila. And she's instantly,
comfort putting it on immediately.
yep, and she is air conditioned. So now at this point, she needs to don her yellow gown and gloves. And booties. So she'll put her gown on, and then she'll put her booties on. Oh yeah, Anna, that would have been nice to tie her up, but that's all right. And then we're gonna put some booties on. We want new booties on before we go into the operating room, because most likely the labor nurse or circulator will have already been in that room, and then they'll have to doff those before going in the hallway, and then we will redon new booties.
Great.
All right.
So
At this point, Rachel's ready to go in to the operating room, and then we'll follow her in there, and then she will doff everything. All right, once the case is over and the patient's either out of the room, or if the patient gets extubated, everybody will leave before the patient. There is a doffing sign on the wall that explains which order to do it, and Rachel is going to demonstrate it. So first she's going to doff her gloves. Nope, doff gloves.
Okay.
And then she'll perform her hand hygiene on the wall. There we go. She's going to grab new gloves. I know they're very tough. At this point, she can either doff her gown or she can wipe, since she's going to be touching the clean sandy wipe, she can wipe her shield off. So you want to wipe first the face plastic, and you want to wipe the hood, the top of the PAPR, to get any possible droplets and goo off the mask. And then she's going to go ahead and doff her gown. So doff the gown with your gloves on, and you're going to spin the gown inside out just like we would if we were gowned sterilely. So she's going to untie and then take everything out from in between. Perfect. And all linen from a PUI or COVID positive patient has to go into a linen bin that has a lid. After everything is doffed, she's going to go ahead and do some more hand sanitizing and donning of gloves. And then she's going to go out the door, and I will help open the door, where then she's going to doff the PAPR. So the PAPR's already been wiped down, and the PAPR will be placed on the Mayo stand outside of the operating room. So Rachel can go ahead if she'd like, and she can take off either one first. You can take the hood off or you can take the belt off. It just needs to be placed on the Mayo stand. And then the techs will clean the entire PAPR set after the case. Then Rachel will go ahead and doff her gloves, do hand hygiene, don new gloves, and then she'll take off her mask. And it's very important when you take off your mask that you're not touching the face of the mask itself, but by taking off the mask by the ties. Every mask that we put on, the front of the mask should be considered dirty, so we want to refrain from putting our hands towards our face at all. So she's going to take them off.
Pretend like that went on.
Yep, pretend. And then she can take her mask off, and then her hat, and then...
That one too.
Yeah, there you
That was definitely went off. Okay. Okay, got it. And then I'm just gonna go ahead and take the whole part of it off.
Oh, then your hat could come off too.
Well, I'm not behind that.
Oh, okay.
Okay, thanks for joining us.